Get started. So, welcome everyone, and thank you for being here. My name is Patrick O'Malley, and this is ShiftChange. ShiftChange is a community built for emergency and urgent care clinicians who are building something beyond the hospital. And that includes physicians, nurse practitioners, and PAs who want to take the expertise that they earned at the bedside and turn it into income, impact, and freedom on their own terms. And that's exactly what today's session is about. Your clinical judgment holds real value far outside the four walls of the emergency department or the clinic. And one of the most powerful ways to apply it is as an expert witness. So today we're going from the trauma room to the courtroom and how cases get evaluated, what attorneys are actually looking for, the pitfalls that quietly cost you credibility and repeat work, and how to take the first step. And I could not ask for a better guide. Our presenter today is Dr. Amy Fogelman. She's a board-certified internist with 20 years inside the Harvard system across primary and urgent care. She's the founder of High Rock Experts, which is a firm that has matched more than 800 experts with legal teams across the country. And she built High Rock Academy to give clinicians the training and the mentorship to do this type of work well. So if you've ever wondered whether your expertise belongs in the legal arena, you are in the right place. Normally, I would say the floor is yours, but Amy, I'm going to say the gavel is yours
Oh, I
today.
love it.
So go ahead and take it from here.
Thank you, Patrick, for that kind introduction. I'm really happy to be here. My expert story started a million moons ago. I was a fifth year primary care attending at Mass General in Boston, and a colleague asked me to review a case that he couldn't take. And it really felt like solving a puzzle, analyzing the patient's care from a new, wider lens. Not only was it fascinating, but it paid well and it sharpened my clinical skills. And that first case, it actually made me a better doctor. You're here because you're curious about expert work, or you're already an expert and you want to get better and you just thought this sounded interesting. So I hope to show you today how being an expert will actually make you a better clinician and how to become a better expert. I'm just going to do some financial disclosures. I'm the owner of High Rock Experts, and I created High Rock Academy, as Patrick said. So we're going to go through a bunch of things today. We'll talk about some top of mind questions, some misconceptions. We'll go through some definitions, some real life examples, some tips for those of you who are getting started, and the pitfalls. And then finally, we'll have some time for questions at the end. So I want to start with the big, elephant in the room question that I get from mostly people who are working as clinicians who've been, working for a while, who are just thinking, is it even ethical to do this work, especially for plaintiff attorneys? And, my answer is like, it depends on how you do it. So I started, when I started, I only did defense cases. In fact, when I first started, I thought that plaintiff cases were totally, the absolute devil. And over the years, my feelings have completely evolved on this. So you can certainly choose to only review defense cases if you want to. And again, this is what I used to do. But if you do that, you miss an important opportunity. And that's because your opinion is based on the evidence. When you do this right, your opinion is just based on the medical facts, not who hires you. It doesn't change no matter which side your opinion is for. And this is really important because sometimes you actually prevent a lawsuit by pointing out, like, for example, that there's no deviation in a standard of care. And this happens all the time. And if you were to say, like, no, don't do any plaintiff work, you would never have the opportunity to do that. On the other hand, when there's true malpractice, our input can lead to meaningful systemic changes. And, holding poor care accountable is what makes medicine better. So, how do I balance this? Well, I recommend that my students do this. This is what I do as an expert. I always ask myself two questions when I'm reviewing a medical malpractice case. What would I have done in the clinician's shoes? And what would I want if this were my family member? And that keeps me grounded and fair. Okay, so let's move on to a more fun question, which is fees. So how much can you make? Um, so, the fee depends on the specialty and location, but generally for emergency medicine physicians who do not have a fellowship, I would say that your fees for depth for just reviewing records would be somewhere between $500 to $650 per hour, depending upon your experience and where you live, and more for testimony. In retainers for board certified physicians, the starting hourly rate usually starts, you know, there, and then you get 4 to 5 hours more for retainers. And retainers are upfront payments that are non-refundable. And then let me just say a word for physician assistants and nurse practitioners. The hourly rates are usually probably, $100 to $150 less per hour than physicians. RNs are even lower, like in kind of like the 300-hour rate for document review. Again, highest cost of living areas tend to pay the highest rates, and you get higher rates for clinical experience, academic credentials. If you're a fact matter expert for the, fact at issue, and your expert experience. And if you're a this isn't really for you guys, but if you happen to have subspecialty experience, toxicologists, this would, apply to you, then that can get some higher hourly rates. So, about me, I trained in Boston in internal medicine, and I spent nearly 20 years in primary care and urgent care in the last 5 years. Today, I run High Rock Experts, and I'm also a proud dance mom, so I know a thing or two about managing multiple businesses. So let's clear up a few common misconceptions about expert witness work. And these are ideas that might be holding you back. So I just want to go over them. And the first one is that reviewing cases, we already talked about this, but for plaintiffs is unethical or dirty. And again, if you stay grounded in the truth and provide unbiased ethical opinions, the attorneys are going to trust your opinions on both sides. And plaintiff reviews can prevent unfair lawsuits or support legitimate cases promoting patient safety and systemic improvements. The second, and just actually one more thing about this. If you don't do plaintiff work, if you, an ethical expert who is going to do this really well, you don't do plaintiff work, then who's going to do it, right? You're going to leave it for people who maybe don't have the best ethics in mind. So I think it's really important that credible ethical experts do plaintiff work. And again, my feelings on this have totally evolved over the years. Okay, second misconception. We've been talking a lot about medical malpractice. That's the first thing that comes to our mind as experts, but this is not the only type of legal case that you'll review as an expert witness. So emergency medicine expert witnesses serve in a wide range of cases. So of course, medical malpractice. Usually these are delayed or misdiagnosis by your specialty or others, procedure complications, handoff or continuity care issues, and triage and transfer and early discharge, those kinds of things. You can also opine on any trauma. These are personal injury cases. you can talk about these, and we'll get into an example of this later. This includes opining on conscious pain and suffering from an accident. And this is because, your clinical training directly involves assessing triage status, pain levels, and levels of consciousness. So you're qualified to reconstruct a patient's timeline of alertness, response to painful stimuli, and physiological reactions to trauma immediately following an incident. You can also, opine on causation, prognosis. This is not a medical malpractice case. This is somebody that is suing the person who caused the trauma. Another type of case is a product liability case. And this is, your role is to review a device or prescription that is used in emergency medical situations and to talk about whether it caused the issues that they're saying that it did. And then finally, as I mentioned before, there are specific cases like medical toxicology cases, um, you know, occupational environmental exposure, overdose, impairment analysis. And then I was just talking to Joe Balesso before. He does EMS cases. So you may have a special, you know, expertise that you'll do different types of cases. So the third misconception is that expert witnesses are always in court. You're imagining, the judge in the robes and the brown wood and, the very scary jury. And in fact, only about 5% of medical malpractice cases involve court appearances. Most of this work is reviewing medical records in your PJs, on the weekends, at night. It's very flexible. So let's go over some key definitions and concepts. The first question is, who's qualified to be an expert witness? And this is the Federal Rule 702, and it's the technical requirement for an expert witness. So you need to have knowledge, skill, experience, training, or education. So every single person in this room has that. It's one of those things. We actually have all 5 of those things. So we are qualified. But, why would an attorney want to hire you over somebody else? So am I special enough? And will attorneys hire me? And so I want to talk about some of the ideal traits that make attorneys want to hire you. And the first is that you're clinically active. So, you may be thinking, oh no, attorneys only want those gray-haired academic people. And it's just simply not true. Sometimes they do, but it's your clinical activity that gives you your special sauce. That's what attorneys want. So it doesn't matter if you're not academic. It doesn't matter if you don't have decades of experience. Usually just about, 3 to 5 years is enough to show that you have enough clinical judgment. The second is that you're a good communicator. That's both with writing and speaking, and that's because you need to communicate to the judge and the jury and come across well. And you need to be willing to testify if needed. Now, I did say, I don't want you to panic, that only about 5% of med mal cases go to trial. A large majority of this is done, on the sidelines, reviewing records. However, you need to be willing to go to the distance because this is why attorneys are paying you those high rates. So as long as you don't have a true phobia against public speaking, you can absolutely do this. You're going to have plenty of time to practice and learn this skill. You also need to have no evidence of poor judgment. And by that, I mean hospital or board discipline, a history of arrests, a pattern of malpractice cases that's higher than, the average for your specialty, or any history of controversial writings. And lastly, you need to be permitted by your employer. And I would recommend just reviewing your employment contracts for that. And lastly, you got to be interested in the legal process. If you're just doing this for the money, it's not going to be something that's going to be successful for you over the long run. So, what do expert witnesses do? Well, you're there to teach the attorney, judge, and jury about the medical aspects of the case. So, you analyze medical records, you educate your attorneys, the judges, the juries, and then you offer unbiased opinions based on the medical facts and the legal definitions. So, now I just want to walk you through a typical flow of an expert witness case. You start with the case intake, and typically a case concludes at any time along the way when it's dropped by the plaintiff, settled, and that's usually a confidential agreement that is reached by both sides, or it's resolved at trial, or it's dismissed by the judge. So you start with a record review. You review the records, you explain your findings to the attorney. You might be asked to write a report and perhaps review additional records. It may be go to deposition. And so you may be asked to give a deposition. That depends a bit on your state. And then it may go to trial. And so the time between the initial review and the trial is typically years. And so you have time to prepare. So again, don't worry about that. You will have time. So why do I love this work? If I haven't made this clear before this, it's because it's totally intellectually satisfying to use your medical expertise in a different way. You make more income without picking up extra clinical shifts. You work on your own terms from anywhere usually, and this extra income lets you cut down on your clinical hours if that's what you want, which is great. So more control over your schedule. It also makes you a better clinician, and it extends your impact beyond patient care. So you're using your voice in a different way. So now let's just go through some real life examples of cases. And these are really tragic cases, and I'm using them to illustrate a few points. So our first case is a failure to diagnose case, and this is from the Massachusetts Lawyers Weekly newspaper, and it is involving a failure to diagnose a urinary tract infection. So a patient came into the emergency department with flank pain, urinary frequency, nausea, and vomiting. The emergency department physicians ordered labs. The UA showed bacteria, Luke esterase, and red and white cells in the urine. The patient did not have a fever. They also ordered CT, which showed a kidney stone, obstructing the ureter and hydronephrosis. They gave her fluids. She felt better. And so they discharged her home without antibiotics. Okay. Well, 2 days later, she came back in fluoride septic shock. She needed maximum dose pressors, and ultimately she survived, but developed dry gangrene in her hands and feet, and she ended up losing her fingertips and roughly half of both feet. So she went to an attorney who wanted to sue the emergency medicine providers. So she was wondering if the amputations could have been avoided. And so I just want to talk about a couple of key concepts. So first, when we're discussing civil cases, which is what medical malpractice cases are and personal injury cases, in other words, not criminal cases, the burden of proof is more likely than not, or more than 50% likely, okay? So the first concept I want to talk about is standard of care. So in this case, did the ED provider, and in this case it was a physician, more likely than not deviate from the standard of care when he looked at those labs and the CT results by sending her home without antibiotics or a urology consult. So the plaintiff's expert said, yes, there is a deviation in standard of care. And the defense disagreed, said, look, there is a lack of fever. The UA showed contamination, possibly. So there was a question there. The other question is causation. So, first, did the untreated UTI cause the sepsis? And, that's a question that an EM physician could answer. And then the second, did the sepsis treatment, the pressors, cause the gangrene and the amputations? And that may be something that an emergency medicine physician could answer, but that also may be a place where you might want to bring in a critical care physician or a vascular surgeon. And, that's why sometimes cases need multiple experts. So in the outcome of this case was that this settled for $3 million just days before trial. And this is a tough one because, I think that you guys would probably agree that it's hard to say, that there more likely than not was a deviation in the standard of care. Okay. But, there was a lot of, you don't know what a jury is going to say. And so it settled. The second case is a procedure complication. And, this is an example of one of every emergency medicine provider's worst nightmares, and that's the difficult airway. And this is from the Expert Witness newsletter, which is a blog on Substack, which everybody, you guys need to subscribe to this newsletter. It is great. So this is case number 4. So this was a 40-year-old female who had cosmetic facial surgery 7 days prior. And she presented to a freestanding emergency department with rapidly advancing neck and facial swelling. So there was an airway concern, and the ED team decided to intubate her before transferring her to a larger facility. And they failed, multiple intubation attempts. And ultimately, one of the EMS paramedics was able to get the tube in, but while she was being moved from the ED bed to the stretcher, the tube became dislodged. And she went into cardiac arrest, and ultimately resuscitation was unsuccessful. So in this case, again, this is a question about standard of care and causation. And the standard of care question here is about airway management in a resource-limited setting. Was intubating before transport the right call? Was it done appropriately given the difficulty? And then causation gets contested in an interesting way. So the defense brought in a pathologist who did an autopsy, and her opinion was that the hematoma itself was compressing the airway and neurovascular structures, meaning that the patient may have died regardless of what happened with the tube. And so that's a good example of how causation arguments can shift the focus from the bedside decision entirely. So again, this case settled days before trial for a confidential amount. And then our third case is a personal injury case. And this is, again, a very sad outcome. And this was in Massachusetts Lawyers Weekly. So a young couple was crossing an intersection with a walk signal when they're struck by a commercial van. And the man suffered a complex arm fracture, but the woman suffered fatal crush injuries. And the intersection had recently been changed from using an exclusive pedestrian signal to a concurrent system, meaning that cars got a green light at the same time as pedestrians got their walk signal. So not only did the lawyers sue the van driver and the owner of the van company, but they also sued the city. But remember, no doctors are being sued in this. So this is an example of the role of the emergency expert was outside of malpractice entirely. Instead, the emergency medicine physician was retained to testify about the woman's conscious pain and suffering before she died. And that's a role you'll see in a lot of wrongful death cases. Again, you're not judging another doctor's care, but you're speaking to the patient's clinical experience and suffering. And this case settled for almost 8 million after extensive discovery and 2 mediations. So here's the thing. None of these 3 cases went to trial. Not one. And that's not a fluke in how I picked these examples. It's actually the rule. Remember the stat from earlier, only about 5% of cases ever reach a courtroom, even cases with devastating injuries. And I also want you to consider 2 important things in medical malpractice work. First, a settlement doesn't mean a doctor deviated from the standard of care. Cases settle for all kinds of reasons: the cost and unpredictability of trial, how a jury might react, conflicting expert opinions. It's a risk decision, not a verdict. And then, second, is the flip side, which is just as important. Even if a doctor did deviate from the standard of care, that doesn't make them a bad doctor. Good, caring, competent physicians have bad days. They miss things and they make mistakes under pressure. Your job as an expert isn't to judge someone's character. It's to look at the evidence and tell the truth about what happened. And that's the ethics of the truth. And that's why this work done well actually makes medicine better. Okay, so how do you get work as an expert witness? Well, you need to have these skills of success. Again, you need to be unbiased no matter what side hires you. And you can do this by screening for conflicts of interest. You also need to be incredibly detail oriented so that you can find that needle in a haystack of records. You need to be professional, and that means handling tough questions and depositions or court calmly and with integrity. And that reinforces your commitment to the truth rather than the outcome. And then, lastly, you want to be a clear communicator. So you're getting your ideas out there in a clear way. So, how do you build this long-term reputation? Well, often that first case comes from your network. So that's people that you know who are lawyers. They don't need to be malpractice lawyers. These are, your cousins, your college roommates. Look at your LinkedIn profile. Think about anybody that you know, your neighbor, and tell them that you're interested in expert work. After that, your reputation does the work. You do excellent expert work. Attorneys love you, they talk, and that's how you build your expert practice over time. And continuous learning, you're always trying to do better. And how do you balance your clinical work with expert work? Well, first of all, you say no to cases if you don't have time. You block time. Some of my most successful students have cut down their clinical schedules by 1 or 2 blocks a week to focus solely on expert work. You set boundaries. That's by staying within your lane of expertise. A lot of times attorneys will try to push you outside and say, hey, you know about this. Even, you're an emergency medicine doctor, but you take care of intubated patients. So can't you opine on this, patient who is in the ICU for 3 months? Don't do that. Stay within your lane. And also, you want to maintain professional integrity. And that means keeping your clinical work and your legal responsibilities separate to avoid conflicts of interest. And, by checking your organization's policies on expert work to ensure compliance. You want to always prioritize your role as a clinician first. So here are some of the top mistakes that I see that I want you to avoid as an expert witness. And they seem really obvious, but I see them so many times. So Number one, not responding quickly to new case inquiries. And by quickly, I mean within 24 hours. So even if you're away at a conference or you're like on nights, you still want to respond. Do not just ghost to the attorney because they're just going to go on to the next, expert on the list. So you want to respond within 24 hours. And even if it's outside of your area of expertise, say so, because this is an opportunity to network and create a connection with that attorney for future cases. I want to tell you, it is so common that I will reach out to experts. They won't respond to me. Don't do that. Respond, because you're just going to be taken off of people's list. And I've already talked about this a little bit, but overstepping your expertise is one of the most common mistakes that I see expert witnesses make. Um, and this is especially common in brand new experts who, really are want to get cases. And unfortunately, this is not a good idea. Your credibility as an expert witness is really strongly tied to the scope of your clinical experience. So when you venture beyond your scope by offering opinions on areas where you lack direct current experience, your testimony can start to feel speculative, which, weakens its impact. So, as I said, sometimes attorneys are going to try to pressure you to go out on a limb and give an opinion that is slightly outside your field or something that you handled in the distant past. And that might feel tempting, especially like when you're a new expert and you're hungry for cases and you want to be helpful to this attorney, but this rarely ends well. So, don't stray into unfamiliar territory because it opens you up to legal challenges and it really can undermine your credibility with the court. So, the best approach is to stick to areas where you have recent, active, substantive experience. In other words, stay in your lane. Okay, this is another major problem that I see people do, and this is documenting without permission from the attorney. I have seen this countless times, and the attorneys get so ticked off. And this is why we learn in our medical training to put everything in writing. But in the legal world, the emails and reports may be discoverable. That means that the other side may get copies of these things. So, an opinion that's contrary to their side may actually harm their case and really tick off the attorney and sour their thoughts about your professionalism. Okay. I've seen experts do this. They think they're being helpful. Oh, the attorney didn't even ask me and I wrote them a report. Aren't I, an A+ student? No, you are an F student. Do not do this. So, always confirm your documentation needs. Emails should just be used for scheduling and billing, not for your opinion, and only write a report if you're explicitly asked. Another big mistake that I see made. This is so common. It's surprising the attorney with an unexpectedly high bill. And this is what I'll say about this. A lot of times, remember, I talked about that 4 to 5 hour retainer that you asked for. Attorneys assume that that retainer is going to cover the initial document review and opinion. And so it will if they send you over 300 pages. But if they send you over 3,000 pages, there's no way that you'll be able to review those in 4 hours. You may know that, but the attorney may not know that. Okay. So here's a typical scenario. The attorney may, send you 300 pages they tell you that they're going to send you 300 pages of records. They pay you a 4 hour upfront retainer. And so, 4 hours times 700 an hour, that's 2,800. But their assistant sends you 3,000 pages of records instead of 300. And then Instead of stopping, which is what you're supposed to do, you proceed to review the records and you send the bill to the attorney for 26 hours of work, totaling $18,200. From your perspective, this makes perfect sense. There's no way anyone could review 3,000 pages in 4 hours. But this, from the attorney's initial mistake, they made a mistake in misstating the number of pages. They may still feel blindsided by that final bill. Attorneys operate within strict budgets and they plan accordingly. So if your bill far exceeds their expectations, it's going to damage your working relationship and reduce the likelihood of being hired by that firm in the future. And this is an example where communication is the problem here. Okay. So instead of just proceeding with, how do you avoid this? To avoid this situation, as soon as you receive those 3,000 pages of records, immediately email the attorney. Let them know that what you initially estimated would take 3 hours to review would actually take closer to 30 hours. Clearly ask, do I have your permission to proceed with this additional time? Clear communication is key. And then by addressing this discrepancy up front, you ensure that the attorney is fully aware of the scope of work and it avoids any surprises when the final bill arrives. Another mistake that I see is, just relying on your medical training alone when starting your expert witness business. Because unless you've had a forensic fellowship, you would not have learned these legal concepts in your medical training. Without knowing them, how do you ensure that you're doing your expert work correctly and ethically? And, you figure with all your medical training, you can wing it and figure it out. So, for example, you'll get an email out of the blue from an attorney about a case. You take it, you check in with colleagues who may or may not know what they're talking about, and you hope and pray that you do a good job. But remember, you don't know what you don't know, and credibility is king in the expert world. So it's important to get formal training. So how do you do this? Well, in order to protect just remember again, first impressions matter. You want to impress attorneys both initially and as the case unfolds. Attorneys talk. They frequently share their recommendations through these, nebulous listservs, professional groups, and word of mouth. So when an attorney is searching for an expert in your specialty, you want your name to be the one that they recommend. In fact, 80% of attorneys rely on word of mouth when hiring expert witnesses. So if you damage your credibility with just one case, you risk losing your future opportunities. And that's why it's crucial to get things right from the start. Credibility is king. You want to protect it by delivering, exceptional work and leaving a lasting impression. So learn the legal basics before you start on your next case. You guys are all here, so you're definitely taking that first step, which is really great. So the good news, there are so many different ways to learn how to do this work the right way. And how do you learn it? Well, first of all, there's some wonderful hiring attorneys out there who will really put in the work and time to mentor newbie experts to mold you into quality experts. But this can really vary quite a bit. Some attorneys assume that you already know how to do this, and they will not put any time into helping you. So there are some great books out there. They're great for foundational knowledge and they're budget friendly. I can recommend some at the end, but they lack the opportunity for hands-on practice, mentorship, or personalized feedback, which can make it harder for you to apply what you've learned to real-world cases. And that's where, a comprehensive course can be incredibly helpful. And while it does require an upfront cost and time, the value is unmatched because it saves you from that costly trial and error, and it sets you up for success from the beginning. So, I hope that I've convinced you that this is a flexible, impactful, and rewarding way to use your skills in a new arena. you help patients, you teach attorneys, and you hold the system accountable. And let's be real, it's fun. So I would love to open this up to questions.
There was, Amy, thank you for this. This is
Yeah.
amazing. And I think that, for people who are very new to this, wonderful overview. And I didn't realize, some of the other roles that we can play, on that third case, especially, um, being able to help attorneys navigate some of those types of issues and not just a straightforward, medico legal med mal case. So thank you for sharing, some of the other things that we could be doing with this. There was there were a few questions. There was an emergency physician who was not able to join live, and she's got two questions that are here in the chat. And I think some of these you have gone through. How do you recommend standing out as an expert? Is it important to niche down, like critical access, or like Joe here, who's an expert in ECMO? Do you really need to niche yourself down? And should we start publishing or speaking directly to med mal attorneys to get on their radars? And I think you've.
Those are great questions. I think niching down is a great technique. When I started out as a primary care doc, I made the mistake of saying, I'm a primary care doc. I do everything, and it was like crickets. And it wasn't until I niched down to, okay, well, opioid pain policy is what I've always done. And so opioid care and primary care. And then I got cases from all over the country. So
Mm,
if you can niche, it will be helpful because attorneys will know. Remember, this is part of what I teach in my course, but attorneys, they're looking for specific cases. So they're not just looking, they don't understand emergency medicine. They might not even understand that they're looking for an emergency medicine doc. They may say, I need a sepsis doc, and call
mm,
me and say, who's the sepsis doc? So it's really important that you make it easy for them, especially, attorneys that don't quite know what they're doing, to
mhm.
find you. And that can be what I would recommend is to search in places like, the Massachusetts Lawyers Weekly. Look and see what types of cases are emergency medicine physicians or emergency medicine physician assistants. What types of cases are they involved in, and see what the most common case types are. Or do you have a special training? But be careful, for something like, okay, POCUS is something that I see people may have a certification in that doesn't necessarily translate to a case that an attorney is going to be looking for. So you really have to be thinking from an attorney's perspective.
Mm. Okay. Yeah,
Is that helpful?
it is. Yeah, absolutely. Um, there's a second question.
Oh, and yeah, and she also asked about talking, giving speech talks to attorneys. That is such a great way to
Yeah,
network. And
because
that is the key to networking, right? You're giving, it's a relationship. It is, look, let me teach you something. And then they say, "Oh wow, Dr. Fogelman, she's really explains things really well.
mhm.
I'll think about her next time I have a question." Or, give them, say, if you ever have a question about a case, just give me a call. I'll be happy to talk to you about it. And then you develop a relationship with them, and then they're calling you, and then all of a sudden they have this huge case and they're thinking about you. So
Yeah,
that's what networking is.
networking and being a go-giver. That's something that I preach and I talk about. If you every time they reach out to you, you send them a bill and kind of flip the script a little bit. They ask you a question, and you're like, okay, here's a bill for $47 because it took me 15 minutes. I imagine that type of approach is going to get you axed every single time.
Absolutely. And I think there's
And
also a concept. Sorry, go ahead. What were you going to
no,
say?
no, go ahead. Go ahead.
I didn't mean to cut
No, no, no,
you off,
no.
Patrick, because
Go ahead. Go
go
ahead.
ahead.
But if you lead with authenticity, you lead with value, and you are showing them that you're available, it's the squeaky wheel gets the grease. And if you are available for those quick one-off questions and just roll with those, not trying to charge them, then they're going to come to you when they need your ongoing expertise. And I'm thinking, how about doing like a lunch and learn? You've got four law firms, within a, close proximity. What if you were to create a lecture and just go by and say, hey, I just want to come in and talk to you guys. I want to share with you a little bit. Or do you have 5 questions? Send them over to me and I'll do a presentation based on some of your common questions about how medicine works or what emergency medicine is. And then you can take that asset, that presentation, and go around and do it to a couple people, bring them some crumble cookies, bring them some coffee, but really just go above and beyond. I think might be an interesting approach.
You don't need to bring them crumble cookies. You just need to teach. But
Okay.
but I would say because I've worked with a lot of attorneys on, I'm sorry, a lot of experts on some of their presentations, it really has to be for lay people.
Yes.
These the
Yes.
we and that is really, really, really important because remember that the average jury is an eighth grade level.
Hmm. Yeah.
And most attorney, if they're a really good med mal, attorneys that have been doing this for years and years and years, they do have, a more advanced understanding of
Hmm.
these concepts. So it could be a bit of a higher level, but you're auditioning for explaining this for the jury. So dumb it down. Don't worry about making it too
Hmm.
basic.
Hmm. Yeah. Now, do any attorneys off? This is an idea that I've had. I have no interest in doing medical legal work myself, but when I was an intern, I started reaching out to a few of the offices in Charlotte where I was doing residency, and I just told them I was like, "Look, I am not an expert yet. I'm still in training, but I can help you navigate some of these cases, decipher some things, and give you real-time feedback as to whether or not there was, any obvious glaring errors of omission and this is something that you need to pursue." And they found that to be very valuable. Is it possible to partner with a few law firms and essentially be on retainer and say, hey, look, you pay me $2,000 a month. I'll give you 3 or 4 hours of my time. You can reach out to me anytime with any quick questions. Call me at any time. And then maybe I do a little bit of education and training just to get something that's a little bit more consistent. Do you think law firms are open to that type of an arrangement?
I think it depends. I think that they could be. The problem is there's a lot of competition for that,
Mm,
particularly from nurses who are legal
mm,
nurses who do a lot of that and will probably do it at a lower hourly rate. Maybe as a resident, the rates could be more
mhm,
competitive, but for an attending physician, it's hard to justify only doing, a couple $100 an hour to
mhm,
compete with the legal nurse consultants. But
mm.
maybe the what I was going to say before is something that doctors don't quite realize. Plaintiff attorneys don't make any money unless they settle the case or
Yeah.
unless the case wins. They get paid on contingency. So this is like out of their pocket. So
Mhm.
they are generally very tight when it comes to paying.
Okay.
And it's not that's not, it's just because there's no budget.
Mhm.
Yeah.
Yeah. And before I started, doing this many years ago, like most of us, we have a negative view of, attorneys in this space. But after working with them and getting to know them, I think the majority, especially on the plaintiff side, they have a good heart. They are trying to do the right thing, but the amount of work and expense that they are fronting on this stuff, I had no idea. It is astronomical. And if they don't win, they don't get paid at all. So it's not uncommon for them to put, sink 100, 200, $300,000 of their own money into a case, and it may go nowhere. So,
But again, that's why it's really good for you to do a good job and be able to say
yes,
to them up front, look,
yes.
do a review for, I don't know, like $3,000 and say, look, there's
Mhm.
no case here
Yep.
because of either there's no deviation in the standard of care or there's no causation. And then they hopefully will say, okay, no case, I'm not going to file this
Mhm.
because they don't want to sink all that money into a case that's not going to go anywhere.
Right. Right. Anybody else have any questions? I think the other one that she had, let's see here. Trevor, you just put something in here. Wondering what is a realistic timeline to get started in expert witness work? 3 to 5 years can be enough. Is it reasonable to take a course right around the 3 mark and start networking?
Yes, absolutely. That's a great strategy to start, especially if you have people in your lives that are attorneys that gives you that sort of insider, lane. That
Right.
can be a really good way to do it.
So never too early to start laying the groundwork and planting some of those seeds, being familiar with how this stuff works, getting on LinkedIn, starting to share your expertise. I think LinkedIn is essential in this line of work. Is that safe to say?
It is, but I would say be very careful. What I see some brand new experts do is they get on LinkedIn and they start talking about expert witness work. Don't
Uh-huh.
talk about expert witness work. Talk about
Uh-huh.
clinical work.
Okay.
But mention that you are do expert reviews somewhere in your keywords, like, expert witness and in your about section. But and the attorneys want you because you're of your clinical expertise. So
Right.
share an article or talk about something that is changing but don't kind of lie about
Right.
oh I see people sort of feel like they need to puff their experience and pretend, and don't do that. And I also, how to get started. I've heard people say, oh, attorneys only want people who have experience. Well, some attorneys want people who have no experience.
Mm,
They like somebody that they can mold. They like somebody who doesn't have that baggage where
mm,
they've had past experiences and past opinions that they have to, look through to make sure that it is consistent with this opinion. So
mhm.
it's just a matter of finding the right case.
Right. Well, and I think it was my iPhone. I don't know who you are, who wrote that comment, but I would encourage anybody who is listening to this, and especially with the replay, if this is work that you're interested in, please connect with Amy. This is what she does. She is a bona fide expert with helping you get to this place and doing so with confidence and competence so that you can do a better job. And with the course and the services that you offer, I would just say that that's an investment. It's an investment in yourself. And if you're not putting money into your 401k, it's not going to grow. If you're not putting money into your business and your consulting work and your expert witness work, it's going to be kind of the same situation. So this would be what I would consider an investment in your future. So if this is something that's of interest to you, check out Amy, connect with her. I've put all of her connection stuff in the chat and it's on the screen right now. But Amy, thank you so much for taking your time to share your expertise with us. Amy is inside of the ShiftChange community, so if you're interested in connecting with her there, we've got some good medico-legal discussions that are going on. I'm here for any and all of you at any time. Shoot me an email, um, and let me know if there's anything I can do to help.
Thank you, everybody. It was a
All
real
right.
pleasure.
Thanks, everyone.